Hi friends, on behalf of Motherhood India, ಎಲ್ಲರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರ. I'm Dr. Manjula Patil, working as a consultant obstetrician and gynecologist at Motherhood Hospital, HRBR layout Bangalore and Hormao Clinic, Bangalore. Today, I'm going to address an important public health problem that women in India are facing. We are losing one woman every 8 minutes because of this cancer. Yes, you got it. Today, I'm going to addressing on cervical cancer. Cervical cancer is the second most common cancer amongst Indian women if you take urban population and is the leading cause of cancer in rural population. Every year, there will be about 122,000 new cases of cervical cancer detected in India, and we end up losing 60,000 precious lives. This is the most common cancer-related death are due to cervical cancer. And across the globe, India is responsible for about 25% of the cervical cancer-related death. When any woman has been diagnosed with cancer, the very first question she asks will be, why me? And probably the next question will be, should I have done something so that I wouldn't have got this cancer? Should I have done something to prevent this cancer? But we as a doctor, if you ask us, for majority of the cancer, the answer is straightforward, not clearly yes. That's basically because majority of the cancers are multifactorial. So you won't be able to tell strikingly that if you just prevent this, if you do this, you'll be able to prevent this particular cancer. But when it comes to cervical cancer, this is one such rare cancer which is preventable. Knowing that preventable, why are you losing so many mothers? That's the reason today I'm going to talk on one of the preventive aspects of cervical cancer. There are two important aspects for prevention. One is basically screening for cervical cancer by pap test, and the second one is HPV vaccine. Today in this segment of Facebook Live, I'll be telling in detail everything about HPV vaccine. Before we move on to HPV vaccine per se, let us know a few things about HPV infection itself. HPV is an abbreviation for human papilloma virus. There are about more than 200 strains or different varieties of HPV viruses, of which about 40 are basically sexually transmitted. And of these, a dozen are basically responsible for 6 types of cancers in men and women, which we call as high-risk strains or the oncogenic viruses. The infection that are caused by these oncogenic viruses are basically cervical cancer. In fact, now it is proven beyond doubt that 99.7% of the cervical cancer are due to HPV infection per se. What are the other cancers which are caused by HPV infection? These are basically vulval cancer, vaginal cancer in women, penile cancer in men, perianal as well as oropharyngeal cancer in men as well as women. How common are these infections? These infections are pretty much common to the extent that they even say HPV infections are considered to be a common cold of a sexual activity. Like at any point of time, about 80% of the women will be having HPV infection anytime in their reproductive life. As I told you, these are sexually transmitted. The moment women become sexually active, she will be at a risk of HPV infection. Does that mean that each one of us as a woman are at a risk for cervical cancer? Absolutely no. That is good thing about it. Like majority of the viral infection, these are self-limiting. That means to say, if you have a good immunity, by the end of 2 years, these infections will get cured on their own. Only in about 10% of the cases where the infection is persistent, and basically caused by the high risk varieties, can lead to cervical cell abnormalities and pre-malignant lesion later turning out to be cervical cancer over a period of about 5 to 10 years. Is there any treatment for HPV infection? Per se, there is no treatment for HPV infection. They are just self-limiting, like majority of the viruses. So what are we left with? So we are basically left with the prevention of HPV infection itself. And a way of preventing this HPV infection is basically by HPV vaccine. What are the various types of HPV vaccines that are available? Depending on the virus against which they are active, the number of viruses against which they are active, these can be bivalent, these can be quadrivalent, these can be nanovalent vaccine. As of now, in Indian market, we have basically bivalent as well as quadrivalent vaccine. Bivalent vaccine is basically active against two types of viruses, HPV-16 and HPV-18, which are basically responsible for about 75% of the cervical cancers. And quadrivalent vaccine is active against HPV-16 and 18, which are there in bivalent as well. Apart from that, it acts against HPV-6 and 11, which are responsible for genital warts. The nanovalent vaccine, which is available in the more developed countries only as of now, will be active against HPV-16, 18, 31, 33, 45, 52, and then 58, which are responsible for about 90% of the HPV infection causing cervical cancer. And apart from that, the two viruses which cause genital warts. How exactly these vaccines do act? These vaccines are nothing but a part of virus. They basically contain only the outer shell of the virus, what we call it as a capsule. They won't have a genetic material. So the moment these are injected into an individual, they stimulate immunological response and then lead to production of antibodies. And these antibodies persist for more than 10 years in an individual. So the moment an individual gets HPV infection, the antibodies will act against those and then literally kill them so that there won't be any chances of infection against which these are intended to. Coming to the fact, who should really receive these HPV vaccines? By the latest Indian recommendation, these vaccines have to be given for all the girls aged between 9 years and 26 years. If the vaccine is given between 9 years to 14 years, 2 doses has to be given 6 months apart by intramuscular route. And if the vaccine is started beyond the age of 14 years, it has to be 3 doses at an interval of 0, 1 to 2 months after the first dose, and the third vaccine has to be after 6 months of the initial dose. In fact, I saw a very catchy advertisement regarding these vaccines. 1 plus 2 is equal to 6. That is basically a single vaccine administered at 2 doses is able to prevent 6 types of different cancers. When it comes to developed countries, these vaccines are in fact recommended for all the girls and boys between the age of 11 to 12 years. In fact, they have included it in the routine universal school immunization schedule itself. And the vaccine they are using is basically Gardasil 9. The question mainly arises now is, why vaccinating boys? They don't have cervix, right? So as I told you, this is basically a sexually transmitted infection. HPV infection is basically a sexually transmitted infection. So by vaccinating boys, we are basically reducing the burden of HPV infection per se. And apart from that, about 90% of the HPV related other cancers which do affect boys, like perianal cancer, oropharyngeal cancers, and the penile cancers are basically prevented by HPV vaccine. That's why they are giving Gardasil 9, which is a nanovalent vaccine for all the boys and girls within the age group of 11 to 12, is given from 9 to 26 years anywhere during that period. Coming to the other factor, how effective are these vaccines? Now there are good number of studies which have proven the efficacy of these drugs, and the efficacy is still persisting beyond 10 years. And the other aspect of this is basically, are they safe? The very moment we are giving any kind of injection, the question a mother asks us is basically, how safe are these vaccines? In fact, across the globe, about 270 million injections have already been administered, and there is no single incident of a fatal or a major adverse reaction. They can have a very minor reactions like injection site redness, soreness, fever, like minor reactions can happen, and rarely they can be a syncopal attack. So a word of caution here would be, and any individual receiving these vaccines should be either in a sitting position or in a lying down position, and should remain there for at least 15 minutes, not to leave the site from where they have taken the vaccination, just to prevent the possibilities of these syncopal attacks. Next important thing, what is the research that is going on regarding this HPV vaccines? The nice things that are going on basically, is there a possibility of just a single dose of HPV vaccine? Yes, there are good number of studies that are coming up, and that is giving a single dose. What is the antibodies, for how long they'll be persisting in an individual, and for how long they'll be effective is what is being studied. And if it really becomes effective, that is going to solve a major burden of cost effectiveness of this particular vaccine. The second important research is basically therapeutic vaccines. That is, identify an individual having an infection, give these vaccines so that we'll prevent that HPV infection, or we cure that HPV infection, and indirectly preventing her from going to a state of cervical cancer. The other thing is basically a local microbicidal gel that they are trying, that is when applied to a cervix, that can basically cure or prevent the occurrence of HPV infection or kill the HPV infection at that site. So these are the research that is going on regarding this. One more word of caution when I say about vaccines. Vaccines are definitely not substitute for routine cervical cancer screening by pap test. After receiving a vaccine, beyond the age of 21 years, once you become sexually active, you should undergo a routine pap smear screening every 3 years till the age of 65. If you ask me, we know that this is a preventable cancer. In fact, I dream of a day when we'll be able to eradicate HPV infection, and in turn are going to reduce the burden of cervical cancer. So on this day, let us take a pledge to do our bit to reduce the burden of cervical cancer and prevent losing the precious lives of our mothers. If you have any questions regarding anything related to cervical cancer, just feel free to start the questionnaire, and even if you are not live, give your comment, we'll just get back to you with the answers. Thank you.